Hi everyone, and welcome to Health with Dr. Yvette Maseka. I'm your host, Dr. Yvette Maseka, and this is a podcast that aims to correct myths around medicine or around health. And today we're going to talk about a sensitive and somewhat controversial topic. So we're going to talk about circumcision. And I'm joined by my friend and colleague, Dr. Oscar Moloa. We're both general practitioners at the University Teaching Hospital. Hi, Oscar.
Hi, how are you?
I'm good. Thank you for being here today.
My pleasure.
So, Oscar, tell me, is there an interesting case that you've seen that involves male circumcision?
Well, in my practice, I don't get to see those quite often. But if I remove the curtain a bit, I'll take you back to my high school days. I recall a time when the ministry was trying to promote circumcision amongst males. And they did a good job at that.
Yeah, they did.
They managed to convince most of my classmates, my schoolmates for that matter, to actually get circumcised. It came as a good turn, really, because I'd been thinking about doing that for the longest time, but I didn't have the courage and the zeal. But I guess the crowd made me do it. Yeah.
So Oscar and I were at the same high school, and for some reason, all the males were getting circumcised at the same time. So you could only see them in lab coats because they couldn't wear trousers or underwear. They were all in lab coats. And we were just wondering, like, what happened? Like, what was the deal behind the lab coat?
Oh, yeah, those are tales we don't tell parents. But yeah, so we got circumcised, and the irony is that classes were being attended by females only.
Yes.
Yeah, so the teachers got surprised, like, what's happening to the males? Is there an outbreak of something? But of course, they caught wind of what was happening. And because it was too late, they couldn't undo the circumcision.
Yeah.
And so we had to stay out of class for almost 2 to 3 weeks or so. And the interesting part is that we were each other's keeper. So every time you wake up in the morning, you'd always check on your friend. How are you doing today? And you're like, I think I've been okay. The other friend was like, I didn't sleep well. And we would always be checking on each other, and would be wearing bathing towels for most of the times with a lab coat once in a while.
Because you're advised to wear loose clothing after. Yeah. So what you had was a lab coat. I met one guy and he told me, I'm just from doing a lab. I was like, oh, okay. And I believed it. Then later on, I found out that he actually got circumcised. And I remember one of my classmates just came into class and just said, girls, stay away from me.
He had a good point.
Why was that?
You didn't want anything that was going to cause trauma.
So after circumcision, you're not allowed to have an erection? It's for the viewers and the listeners too.
Well, if you could abstain from having one, you're safer, you're better off, and you'll not have to endure any pain. Okay,
so, well, what was your reason for circumcision? Well, I know circumcision dates back to ancient times, before Christ. I see circumcision in the Bible being mentioned.
Quite frequently, actually.
Yeah. So, God told Abraham?
Well, yeah. Right? Apparently, God spoke to Abraham and told him that every male child on day 8 of their birth needed to get circumcised. More or less a right into being a Jew, really. It was almost that as if you're not circumcised, you are not a Jew or an Israelite per se. Yeah.
So circumcision is done because of religion. So Jews, I know of Islam also, right? Yeah, they do circumcision, even in African culture, which is quite
even in
quite
Zambia.
Common. Yeah,
I know it should be Northwestern Province.
Northwestern Province. I mean, I'm Luvale myself.
Okay.
So we have this famous Mukanda ceremony.
Oh yeah, I heard about that, and tales going around about hot knives. I don't know how true that is.
Yeah.
Maybe
so
our subscribers can leave some comments down below and
on what happens in the Mukanda, right? Because I have a cousin who underwent this Mukanda, and I don't think they're allowed to talk about it. So the rumors that we were hearing was that they just, they line the boys up, and the I don't know if I can call him the leader, just gets this knife, just one knife, and just, just goes around and
A little scary.
yeah, a little scary, and you know, just imagining blood all over. But he actually said that they are now trained and they use sterile blades, and those blades they use one blade per person.
Okay.
So that whole
I always
story
thought it
about
was the same thing. Yeah. Okay, it's okay.
no, apparently they don't use the same thing.
All
They
right.
they use a single blade for each person. Maybe you can highlight some of the difficulties. I mean, not difficulties. Some of
Adverse
the
outcomes.
some of the adverse outcomes. I know we're always talking about benefits, but I think it's important that people know the complications of circumcision.
So, for starters, nothing on this earth has got or goes scot-free from adverse outcomes. I must state that. So, circumcision, male circumcision in particular, has got its own share of buttons. So, some of the common things that are seen are bleeding post-procedure. Sometimes they'll have a penile amputation, but that's like
That sounds very scary.
that's like a minute. I would give it at 0.2% and probably more common in the younger ones. But generally, it's a safe procedure. So much so that the risks are insignificant. If I was to bet on it, I would.
Okay.
Yeah.
I also read that the most common complications include complications from the anesthesia that they use, which we won't go into because that's a whole other topic. And there are some people who actually report having some irritation of the head of the penis as well.
Okay.
Yeah. But you know, we're always saying we're always talking about circumcision and saying that it's a decision that people make, right? But there are times when we offer it as treatment. Yeah.
Precisely so.
Yeah. Some of the times include if you come with what we call phimosis. So phimosis is where you fail to retract your foreskin. So when you come with that, we offer you circumcision. If you come with another condition that we call paraphimosis, this is where you retracted your foreskin and it becomes tight. So
It squeezes your head.
yeah, it's like a tight ring.
Yeah.
So in that case, we also offer you circumcision. If you come with like genital warts that are on the foreskin, we'll offer you circumcision. If you come with a growth on your foreskin that may be cancerous or looks like it can become cancerous, we still offer you circumcision. And if you have inflammation or infection that affects the head of the penis and also your foreskin, we still offer you circumcision. So in as much as circumcision has those health benefits, sometimes we use it as treatment. So maybe Oscar can highlight some of the benefits.
Well, first, let me state the reason I, probably with a host of my friends, decided to actually go for it. Is that I think there was rumor to say that when you get circumcised, you become cleaner. It was rumored that when you get circumcised, the risk of getting HIV is lower.
Yeah, those
Numbers
are some of the myths.
Somewhere between 57 to 70%. Yeah, I'm sure they're standing at about the same even up to now.
Yeah.
And most guys were won over by such statistics. And I think we all delved in with everyone was scared of HIV, probably even up to now. Of course, we have new medication that really helps. But I think if you can have an extra trick up your sleeves, circumcision was the way to go.
Yeah,
and I think so the majority will report a few things that they're not so happy about, or rather rumors that they hear say it reduces your sexual pleasure and all. I will come to that, but just take note that it reduces your risk of STIs for most of them.
Yeah,
like the chlamydia, syphilis to some extent. Though not quite significant, but to some extent it does. and also reduces your risk of HPV and herpes simplex infection. And that's on the male side. But remember that when you have a lower risk of that, it also translates to your partner if you have a partner. So you will reduce the risk of your partner contracting the same as well.
Yeah, so if you're not doing it for yourself, you do it for your partner. Now, we're saying this because one of the infections that Oscar has mentioned here is HPV. Now, HPV is notorious for causing genital warts and cervical cancer. And in males, it causes penile cancer. Now, you may think these, especially penile cancer, you may think it's rare, but when you come to hospitals like UTH, then you can see that, okay, it's really out there. And the people I've seen that have penile cancer, I think in the last month, I've seen maybe 4.
Okay.
None of them was circumcised. None of them.
It adds credence to our circumcision.
Exactly. So
Maybe.
if you want to prevent things like penile cancer, get circumcised. Because each one of them had to retract their foreskin, and you just find the head of the penis is like, it's been eaten off. It's like, it's gone.
Oh, sad state.
And it's very traumatizing. And you can see that these men are really, really affected by it. It's a sad scenario. I don't think I would want to see any man getting penile cancer because, I mean, that's the pride of a man.
I guess people are asking, is there room? Maybe it's now 15, 20, 25. Is there room for them to get circumcised? Maybe.
Yeah.
And
a circumcision can be done at any age.
Yeah, exactly. I wasn't a toddler. I wasn't an infant.
Yeah. But do you wish that your parents would have done it when you were an infant?
I think I would. That 6 period that they gave me and my friends to heal was a small little period of anxiety. I didn't know what was going to happen. At some point, I thought I was going to have an amputation. That was the most scary thing. In fact, a friend of mine would often laugh at my decision, saying you have 2 eyes. If you pluck out one, you can still see, but you have one of your manhood, and if it's cut off, you're gone.
I'm assuming that friend didn't get circumcised.
He didn't then, but now he has.
Okay, did he tell you why he got circumcised?
He says, look, it's probably 1 in a million chances that you're going to lose it.
Well, that's true because when you think about circumcision, it's one of those, it's like the oldest surgery that has been ever performed. And the risks are very, very minimal. The complications are quite minimal. So what's your take on the debate that's around circumcision? Because in some countries, they are debating on whether they should wait. They should have a law that allows them to wait for the children to become 18 years for them to have circumcision, because they believe that circumcision when the child is still an infant is child torture.
Well, really, it depends on how you look at it, but it's arguably it's something that people can consider. You might want to allow your children to make their own decisions. But remember, by and large, we are shaped by our guardians, our parents. There are a lot of things that they do for us without our consent, as it were, but we're really for our own good. Yeah, so if you want to stand with a norm that let them have their own say, it's not cast in stone. You probably could run with that. But personally, I'm of the view that for things that we have been through and know are for the ultimate good, we can really put a caveat to it and offer them that procedure while they're young and they're not able to have that infliction of pain for that duration. I know someone would say it's their choice. Yeah, but it's not cast in stone. You could go either way. But remember, the risks are lower when you do it when you're young. Okay, and remember, when you're young, you also prevent your children from having recurrent urinary tract infections. So it also adds that perk to it. Yeah,
and UTIs are a nuisance in children, especially boys. You know, it flips. When we're younger, boys are at risk of getting UTIs more than females. Then when we grow up, it's the other way. Females are at risk because you can find a child having fevers. Your boy child is just having fevers.
And
it's
throwing
just
up.
and throwing up. It's just a UTI. Because UTI can do that to your child. They'll throw up, they'll have a fever. You won't even know what's happening. They'll have no appetite. And it's a UTI. Very common in children. But circumcision prevents that even in adults. The other thing about circumcision is that when you have that foreskin, you retain a lot of moisture in that foreskin. So this becomes a playing ground for, fungi, for all these bacteria. Of course, the body has naturally occurring bacteria and fungi, but when you have that moisture, it becomes, they flourish. They are happy to be there. And imagine you have your partner and you pass on those infections to your partner. So you find that your partner is always complaining of having these recurrent vaginal yeast infections, or also having these bacterial infections in the vagina, but it's just because you're not circumcised. So if you're not circumcising yourself for you, do it for your partner so that you prevent, the cervical cancers and also these recurrent yeast infections.
Yeah, exactly. And remember, it's a small bitter pill that you have to swallow for yourself and for your partner.
Yes.
And ultimately, you feel cleaner.
Well,
you probably would feel more manly. Of course, that's debatable.
I believe you because you've been on both sides.
Yeah.
So I really believe you. So when it comes to the benefits that we've mentioned today, we are preventing UTIs. We're reducing the chance of you getting STIs. We're also reducing the chance of you giving your partner, HPV that leads to cervical cancer, that leads to genital warts. You're also preventing penile cancer in yourself as well. And the other thing that we don't normally talk about, I know this discussion is about circumcision. There's still parts of the world that are doing female circumcision, but of course, it's now being called female genital mutilation because it goes against human rights.
Okay.
Yes, you're not supposed to undergo such torture. It's very cruel. So the World Health Organization is working so hard to, get rid of this practice. You know that there are over 200 million girls and women who have undergone this mutilation.
Oh, that's the first
Yeah,
time
not very common in Zambia, but common in like Eastern Africa, Northeastern. Yes, someone on the set is trying to argue. No, it's very common. Even in Asia, it's quite common, not very common in Southern Africa. So that's why we're always talking about male circumcision, because male circumcision it's a medical procedure. It can be done, in a hospital. But when it comes to female genital mutilation, it's always done in a traditional way and unsafe, unclean environment. So I just hope it comes to an end.
Yeah, just so that we don't forget it. I think someone would still recall that I said that there are people that are worried about their sexual function.
Yes.
Yeah, so
and that's a big thing.
Yeah, so stats show that really there is very minimal to no adverse effect on their sexual performance.
Actually, I came across another study
that
was claiming that men that are circumcised are actually more sensitive than men who are uncircumcised.
Yeah, so there's this quite varied information that but by and large, you shouldn't worry about having to have less pleasure in your sexual life. I think that's the take-home point.
Yes, and interestingly enough, in Zambia, I thought most of the Zambian population is circumcised, but it's less than half. So most of the population that's circumcised.
Well, no one wants to go under the knife.
True. Most of the population that's circumcised in Zambia comes from Northwestern province. And of course, we know why, because of the Mukanda ceremony.
We should have a few Mukandas around Zambia.
Yeah. We should. The least percentage is in Eastern province. So Northwestern province has like 70%. Eastern province is like at 3%. And a study was done where these men were asked why they did this procedure. About 68% did it because it's their tradition, it's their culture. I mean, it's them transitioning from being a boy to a man. That was why they did it. 27% of them said because they knew that it would reduce the risk of them getting things like HIV.
Yeah.
Then
and remember that by and large, men, I'm a man, we don't love anything that makes us feel a bit weak.
Yeah.
So most men would not want to go through the phase where they feel invalid or they feel helpless.
Yeah.
And so they fear going through for that procedure. And I guess that's where the perk of doing it when someone is an infant comes in.
Yeah. And less than 10% said that they did it because of hygiene. Really? I thought most of them would do it because, it reduces your risk of getting HIV and whatnot. But
look, at the end of the day, whatever reason that you decide to do circumcision, be convinced about it. If you're a child and your parents already helped you out, go and thank them for sparing you the trouble of going under the knife.
Yeah.
Yeah. And personally, I fear that if I disclose my decision to my people, my guardian, they would be quite unhappy with me. To the contrary, they were having a hard time finding the best way to approach me and actually convince me to go and have it. So it's a thing where you're both afraid of how the next person will react.
Yeah.
Then when you meet and talk about it, then you're like, oh, okay, we're actually thinking of pushing you to that direction as well. You've actually aided our.
So they were happy.
Yeah.
And also, I've heard a lot of women running away from men because they are not circumcised.
Oh.
So
that's unfortunate.
Yeah, it's unfortunate.
And
it's discrimination in a way, but
yeah, you don't want to have that reason. So you could avoid it.
Yeah, imagine you're talking to someone, you're like, why didn't it work out? And you're like, oh no, he wasn't circumcised. Anyway, that's on a lighter note. But Oscar, thank you so much for having this discussion with me. I hope everyone has gotten a thing or two from this discussion. So circumcision it's a voluntary decision, of course, but sometimes we offer it as a treatment option. If you have a male child, if you're not comfortable with doing the circumcision, or you feel that this is a decision that your child should make once they're, 18 and they're able to give consent, then don't do it. Yeah. So thank you so much. This was Health with Dr. Yvette Maseka. Please visit my website. It's healthwithdryvette.com. And if you have a topic that you want us to discuss, please leave it there. If you leave it on the website, it goes straight to my email. And if you're comfortable leaving it in the comments, please do. Thank you.